China is opening up, just as many parts of the world are tightening up to Chinese travellers. Countries from India to Italy are nervously eyeing these scenes and worrying about the lack of data, particularly when it comes to new variants. After rolling back its pandemic restrictions earlier this month, China is now in the grip of an explosive COVID-19 outbreak. After years of a zero-COVID policy, its population is vulnerable, and its hospitals are buckling under the pressure. The wail of funeral processions constant. The numbers so high, some families are being asked to delay. This doesn't match the official numbers. Yesterday, China reported just one COVID death. It's more like 9,000 a day, according to a UK health data firm. The US is the latest country to impose testing on visitors from China. In the UK, the situation is still under review.
What we understand at the moment is that the variant that is in China currently is already prevalent here in the UK. That's why the risk to us is a new variant. That's what we're watching out for.
Italy is leading the charge for testing in Europe. And today, the country's Prime Minister urged the rest of the EU to follow its lead. But EU officials couldn't agree. 1 in 2 passengers arriving at Milan's main airport are said to be positive for the virus.
Now, where the epidemiologists will need to be thinking about is there scope for new variants that might break through, that might lead to a different sort of infection? And should we be trying to keep a close tabs on that possibility? My instincts are that it would be wise to put in place that kind of surveillance. We just can't rely on the Chinese to give us the heads up of any emerging threat.
Today, a top Chinese epidemiologist stressed they are keeping track on new strains and that all findings are shared globally. He's also warning about cases spreading as millions of factory workers return home for the new year. It's not that China doesn't have vaccines, they do, but they insist on using their own, even though tests show they're less effective. Hospitals are full of the over 65, and they're especially reluctant to get vaccinated. Protecting them will be crucial to avoiding a healthcare crisis.